you.
Doctor, can you please tell us a little bit about valvular heart disease?
Sure. So, valvular heart disease is a very important cause of cardiovascular disability and death. And it's important to understand that in the developing world, such as India, for example, infections such as rheumatic heart disease are the primary cause of what affects the heart valves. And in the developed world, it's actually the aging that affects the valves. But in either case, valves can become narrow, they can become leaky, and they can ultimately lead to heart failure. And therefore, it's very important to properly diagnose these conditions, the heart valve disease, and to undertake proper treatment for heart valve disease. And if you look at the global burden of valvular heart disease, it affects almost millions of people around the world from different causes. So this is an important health issue.
Absolutely. Now, a recent potential problem was discovered with implanted valves. Can you talk about that a little bit, please?
So I think that I want to be cautious and use the word, or rather not use the word complication. I think that it is important to point out what we did was an imaging study. We used high-resolution CT scanning, and we looked at patients that are undergone valve replacement, either surgically or using transcatheter techniques, because transcatheter valve implantation is gaining quite a bit of popularity. This is something that we can do less invasively. We can actually send patients home in a couple of days. And these are tissue valves that actually do not require blood thinning medications. But what we found was that in about 10 to 15% of patients using sophisticated high-resolution CT scanning, we found that one or more leaflet of the valve was not properly moving, and ultimately through a series of deductions, we established that this was related to formation of blood clot. So I think this was in contradiction to what we had believed thus far, that the tissue valves do not have any issues with formation of blood clot. So I think I want to be very careful and cautious, not call it a complication yet, but it's an imaging finding, and what it does is basically sets the stage for us to look at this issue through further research.
Okay. And patients don't need to alter their medication or anything like that.
Yes, so I think the first thing that I want to say is that at the current time, there are no indications that we should change patients' medications.
Watch the remaining show on ITV Gold. Subscribe to ITV Gold on Time Warner Cable Channel 1539. ITV Gold is America's first full-time television channel that caters to the South Asian community. Your favorite dramas with English subtitles. Watch movies, back-to-back songs, award-winning local news coverage, and much, much more. Subscribe to ITV Gold on Time Warner Cable Channel 1539, part of the 8-channel combo pack for $39.95. And our East Coast viewers can also subscribe to ITV on RCN Channel 476 and Cablevision on Channel 116.